before we get into the COVID update, Mr. O'Donnell is going to walk through the pulse report and the slide dates that we use to provide the data. I just wanted to remind folks that we are in flu season, that flu season is upon us, and we've worked very diligently with our occupational medical services and our other partners to establish employee flu clinics as well as community level flu clinics. According to the CDC and the ACIP, their ACIP committee, the flu vaccine and flu shot is recommended for all individuals who are eligible to receive them. But first and foremost, we want to remind those individuals that small percentage of the population who is still unvaccinated, excluding those individuals where a vaccine is forthcoming on the horizon, but we encourage all folks to get vaccinated. And then in addition to getting vaccinated, get your flu vaccine. And so I'm just going to go down a list of those clinics summarily, just quickly before we get into the COVID update. And so we have employee clinics scheduled on the following days. This information will be posted on our website, and there will be additional reminders for the community as we identify additional sites or solidify those sites that have yet to be determined. We have community employee flu shots scheduled on October the 14th, October the 20th at our Dennis Avenue Health Center from 9 a.m. to 12 p.m. We have an employee flu clinic scheduled on October 27th at 1401 Rockville Pike, third floor conference room from 9 a.m. to 12 p.m. At 401 Hungerford Drive, conference room A and B on October 28th. And this is again from 9 a.m. to 12 p.m. Quickly shifting over to our community flu clinics. We have a clinic scheduled at the University of Shady Grove on Friday, October the 15th for faculty and students from 10 to 11:30, and then for the general public in the afternoon from 2 p.m. to 6 p.m. And then again on Friday, October 22nd, public clinic from 2 to 6 p.m. We're also working with our school health services and our Montgomery County Public School partners to identify 3 possible high school sites to be determined and open to the public. And so at this time, I'll ask Mr. O'Donnell to shift and pivot over to our COVID update and run through the slides. We continue to maintain the lowest test positivity and case rate in the state of Maryland. The case rate is 10.86 as of this morning. Our test positivity is 2.06%. We still see moderate to lower transmissions of the virus in the community. We had 103 cases reported this morning, 13 hospitalizations, and 1 death. We continue to vaccinate those individuals in addition to the Pfizer vaccine being eligible to those individuals. We vaccinated 882 individuals who are immunocompromised, and this has come online since Moderna was authorized for this population. And so, Mr. O'Donnell, I'll stop here, and if you would walk the council through the slide deck regarding our rates, breakthrough cases, our planning for boosters and third shots and where we are and the numbers that we have for that. Also, those 217 community partners and providers who have vaccines available, and then a little bit about our scheduling and our targeted sites based on our projected demand for those individuals who are eligible, who've received the Pfizer series. So I'll stop there and turn it over to Mr. O'Donnell to continue with the presentation.
Thank you, Dr. Bridgers. I believe you've covered most of the latest trending numbers with transmission rates and cases. Just as an update, the numbers continue to tick up with our percentage of county residents vaccinated across the board. Of all the eligible vaccinees to 12 and over, we are now at 89% fully vaccinated, 98% with at least 1 shot. Again, I know you touched on this. Montgomery County is our transmission rates have been trending down from the state reports, and the case rates per 100,000 were just a little over 10. If they continue to trend down, we'll move into the next lower category of community transmission. We certainly hope that we continue to go in that direction. Within the areas of the county where vaccinations have occurred, we continue to, as we get towards the last percentage points of eligible populations, there are very few neighborhood tracts that have lower vaccination rates. We continue to work with our community partners and our outreach partners to try to increase turnout and provide vaccination events in those neighborhoods. We've seen as we track the racial and ethnic rates of vaccination, we continue to see each of our groups trending upwards. Our Black and African American residents are now within 2 percentage points of our white non-Hispanic, and our Latino populations are at a very similar level to our Asian and Pacific Islander populations. Again, just to remind folks that it's hard to track to the exact percentage point since we do have individuals who don't indicate their racial or ethnic background. To address the issue that a lot of people do bring up about breakthrough cases or cases that occur within our vaccinated populations, we do see about a third of our cases and a third of our hospitalizations are individuals who have previously been vaccinated. And those numbers are a little bit higher, again, in our county because we have such a high vaccination ratio, vaccination to unvaccinated. When we look at the percentage of cases and hospitalizations that are attributable to the very small number of people still unvaccinated, you see that they make up a very high percentage of those cases relative to the number of people that are still remain in that group. When we look at who is becoming significantly ill and hospitalized amongst our vaccinated populations, it is predominantly our seniors, those over 50 years old. So that certainly, based on our local data, makes a pretty good case for looking at boosters as something that can help to increase the immunity response in those seniors. As we're keeping track of the vaccinations that are going on and the testing going on, we do continue to see an increase in testing across our county provided sites, as well as seeing high testing totals across all providers. At latest count, there was approximately 39,000 tests provided last week amongst all providers. So still a robust quantity of testing occurring throughout the county. To go to the latest on the booster authorizations and navigate through where our federal partners were, on Thursday evening, the CDC director took the information provided by FDA and the CDC Advisory Committee on Immunization Practices and issued an official authorization from the CDC. Friday morning, Maryland issued their authorization in concurrence with the CDC guidance, and that day Montgomery County began administering booster shots at our public sites. To clarify who are getting these third doses, what we call a third dose is specific to individuals with compromised immune systems, and that is at least 28 days after they've received a second dose. This is considered part of of the normal set of shots that immunocompromised individuals need to get. They're recommended to get three doses now, and that has been approved for both Pfizer and Moderna. Not yet the Johnson & Johnson vaccine. As far as the booster shots that are now authorized, that is only for Pfizer recipients, and it needs to be at least 6 months after the second dose has been given. The groups that have been recommended to receive them are any individual age 65 and older, and any individual age 50 to 64 with an underlying medical condition. The CDC has also authorized other individuals from 18 to 49 with the same underlying medical conditions, as well as individuals with an increased occupational or institutional setting risk. So the question does come out, what are those medical conditions and what are those increased occupational risks? They are essentially the same medical conditions and same occupational risks that were used during the prioritization phase of getting vaccine out. So I won't go through all of these. It's a fairly long list. We will have these up on our website to help people navigate if they're in one of these groups. And again, it's the same priority groups that we used when we rolled out the vaccine. Just to help folks understand how the process works when you get to a vaccination site, if you're looking for a third dose or a booster, if you're immunocompromised and it's been over 28 days for your since your last vaccine, you can receive Pfizer or Moderna. We'll ask to see your vaccination record, either your card or a printout, because we want to ensure that we're giving the right vaccine to you and it's been the right amount of time. If you don't have access to those, we do have a process of looking that up. It does take a little more time to do that. So we ask people to bring their records when they can. As far as the booster shots, if they've received Pfizer and completed their first 2 courses, we just ask that they attest that they have one of the underlying medical conditions or are in one of those occupations. We don't require any documentation or proof of that. We also emphasize that the COVID-19 vaccines are not interchangeable. We've been asked to ensure that those who receive Pfizer, those who have received Moderna would receive Moderna. We do expect that the federal government is looking at the Moderna data, and we hope to have an update on Moderna boosters and J&J boosters sometime in the near future. As far as how that impacts the county's plans for rolling out boosters, we did plot out the doses that were given out across all county providers back in the spring, and then plotted that against a 6-month return from those second doses. And we see that, again, that was predominantly our seniors over the first few months. The way this worked in our county was that the county received primarily Moderna for the first few months of our operations, while our pharmacy partners who were doing assisted living and other congregate living spaces were primarily working off of Pfizer. So we do expect that those pharmacies that are now providing boosters to those congregate living facilities are very active now, and they're providing the Pfizer boosters. The county expects to be a little bit busier once Moderna gets approved, since a lot of the residents who are not in those facilities did receive Moderna initially. We do have a pretty good estimate of what number of people that is by age. It's a little bit more difficult to estimate the numbers based on the very long list of medical conditions and the long set of groupings for occupational risks. That and the fact that it's going to be a self-identification process makes it hard to pin down exactly how many people will be coming out. We have, in addition to the number of immunocompromised individuals we've seen since that started, the county sites have seen over 300 individuals coming in for a Pfizer booster so far. We do want to emphasize that the rollout of these boosters is a little different than the first and second doses, largely because vaccine is much more widely available now. Our pharmacies and our grocery chains, as well as our private providers, all have access to vaccine. And we looked at how many of these are listed on the state site. There's more than 217 vaccination sites visible within Montgomery County. We are not telling individuals they need to go back to the same place they got their second dose. For many people, if it was a mass vac site or some of the other sites, Those are not going to be in existence right now. Even the sites the county worked out of, we've had to move out of necessity to different sites throughout our response. So we're encouraging folks to go online, search out where these are. Our call center will help people find vaccination sites. One thing you want to do is just make sure that they have, if you're due to get a Pfizer booster, that they have Pfizer. And then when the other ones are authorized, that you, again, just determine which vaccines the site has. We still want to emphasize the priority of getting everyone a first and second dose. That is still an incredibly high priority of ours, even while boosters are going out, because those are the individuals at the greatest risk right now for obtaining COVID or passing it on. Again, we are planning to do this with a number of our partners, just as we've done the other vaccination rollouts. Our nursing home and assisted living and long-term care facilities are working with specific pharmacy partners to get vaccines out to them. We've been working with aging and disability and our group homes and DDA homes. We have a number of partners, including Giant and the Primary Care Coalition, who are working to ensure that they all have access to vaccines. We will continue working with our minority health initiatives as well and our hospital partners. I can't say enough about how much the minority health initiatives have done to increase vaccination rates, ensure that the conversation is occurring within all of our populations in our county. The data we showed you earlier on vaccination rates amongst our different ethnic and racial groups really helps to hammer home how important these partners have been in getting people vaccinated. We do plan to expand the volume that we can do by moving to some larger facilities in the coming weeks. By October 11th, we are looking to routinely be at East County Recreation Center, Montgomery College Germantown, and the Silver Spring Civic Building. In some cases, this will be 7 days a week. In other cases, it will be for a certain number of days a week, as is available from the buildings. We're already beginning to onboard staff to develop that surge capacity, and we'll continue to plan to go back to the pop-up sites, the independent living sites where we did previous vaccinations. We realize not everybody has the ability to get out to the sites which we're running in the county. And then finally, to turn our attention to the pediatric vaccination updates. I know a lot of people are very anxious or really looking forward to the expanded age groups. We're monitoring along that. We, to the best of our knowledge, it looks like Pfizer will present some data very soon, and it may take 4 weeks or more for the federal government to issue an authorization for that, which would put us near the end of October or possibly in November. So we are tracking along with that. We'll, of course, work with our school partners as far as getting messages out and doing some clinics at our schools. We're just emphasizing that because of the younger age of these kids, it's going to be very important to have their parent or guardian with them, not only for the consent portion, but also because younger children really benefit from having their parents there, and our clinical staff benefit from having the parents help us get those shots into their kids. So again, we'll coordinate with all of our county partners on the rollout of the pediatric vaccinations as well. That's all the updates I have for you all today, but happy to answer any questions.
Thank you.
Mr. O'Donnell, you can stop sharing your slides. Thank you.
Great. Thank you, Councilmember Friedson.
Thank you very much. First of all, I really appreciate the presentation, all the hard work, the fact that the numbers are going down, that we have the best numbers in the state, 10.86 and for case rate and 2.06 for test positivity is a testament to all of your hard work, and just want to thank the public health team for that. We hope that these trends continue, that we reach the Delta surge and that we're on the better end of it, but we have to keep up and continue to be diligent. And again, thanks for continuing to work on the vaccination effort to make sure that everybody is vaccinated in our community. But certainly where we stand with perhaps the best number of any large jurisdiction in the country is remarkable and continues to be the reason why we're doing as well as we're doing. Appreciate the update on boosters. Do you have an expected timeline? You had mentioned about Moderna and Johnson & Johnson. I know we got the timeline expected, give or take, with the 5 to 11-year-old approval, but is there an expected timeline for Moderna, Johnson & Johnson boosters that we should be aware of and the residents should be aware of?
So I'll jump in. I know Dr. Stoddard and I have been talking about this. We originally thought that that we wouldn't start vaccinating folks until actually next month, and then ACIP changed and FDA changed, and we vaccinated them 2 months earlier. The original window was 8 months, then they reduced it to 6 months. So for the 5 to 11-year-old, the data that I'm seeing, the information that I'm seeing, it may be early November. For the 5 to 11-year-olds, we're waiting now to see if Moderna will submit their data and the results over the next couple of weeks. The original challenge was their initial report looked at a reduction in their dosage for a booster shot, and they've gone back and they've reassessed their data and they will be presented. That's pretty much what I've read over the last couple of days.
My understanding is that Moderna has submitted the data for the booster specifically, and that FDA is reviewing it. And I think that same 3 to 4 week timeline that Mr. O'Donnell alluded to for the 5 to 11-year-olds would apply to that review process for the boosters as well. So my guess is certainly by the end of October that Moderna boosters would very likely be approved. They will follow the same process with the FDA advisory group, the ACIP, the FDA, and CDC opining on them before they're launched. But I would guess that 3 to 4 weeks would be what I would expect.
Thank you for that. A few questions following up on the hearing we had a couple weeks ago regarding some of the MCPS works. I see Ms. Dublinsky has just put her camera on. Some of this is a combination of the health department and DHHS and MCPS, and so I'll just ask broadly, and whoever would be most appropriate to answer, I would appreciate it. Just regarding contact tracing, who is responsible for contact tracing, specifically when a positive case is determined? Is that DHHS? Is that the principal and MCPS? Is that a combination?
So I think, good morning, Councilman Friesen. I'll start that, and then I think Mr. Blinsky can jump in on this. But I think it's important to make a distinction between close contact investigation and the formal thing we call in health contact tracing. And I think that's been a challenge. And in that sense, but what you're calling contact tracing is both the process of identifying people who have been in close contact with a case that is positive, and that's an MCPS role, sharing that information with our disease control team so that they can do formal contact tracing, and what the state is part of an HHS function. So once we have those names, then HHS and the state take over and do the contact tracing, the formal contact tracing process that we've been familiar with for most of the last year.
So determining who was a close once the positive case is determining who was a close contact and therefore would have to take protocols, including quarantining, is an MCPS responsibility. The broader public health contact tracing in terms of the transmission of the virus is the health department. I just want to make sure I'm clear.
No, that's correct. That's correct. And
we have been working
with MCPS to identify the teachers and the admin to identify those close contacts, as Dr. Kroll indicated, and Ms. Blinsky is on as well. She can confirm the role and the process that we went through to identify the support mechanisms and the notification mechanisms that would identify those close contacts, and we would do the outbreak investigation, determine the level of community transmission, et cetera.
Okay. And who is training them? How are we recruiting the contact tracers? Are we asking for more folks to do this? Is there an opportunity for those with subject matter expertise to volunteer to help with this? given the fact that it's, a substantial undertaking for the school system?
So, Councilmember, I just wanted to just ask, and this is we can do the questions and we can do the question and Q&A, but we had actually thought that we would give you all a more integrated view of what's happening with the school system, both in terms of testing, rapid testing, and the results that we're seeing, and the processes that we've been going through. If you like, we can do the questions one off, but we could also just do a full.
That'd be great. Then I'll hold off on remaining questions, and we can get to it at that point. Okay. I'll then hold on. I have a couple other questions, but I'll wait for that. Dr. Kroll, appreciate the fact that you were doing that, and I will hold off at that point. So I'll yield back to you, Mr. President.
Okay, thank you. Council Vice President Albornoz.
Thank you both very much. You've covered just about all the bases I wanted to have covered this morning, so thank you. Just two quick questions. I know that we had developed a robust transportation plan for families that were not able to access various health clinics, during the vaccination process for all of our generations, all of our age categories. I just wanted to confirm that those same transportations will be available to families once we are able to secure vaccinations for kids between 5 and 11.
So I could say that I know we had done transportation for elders in the community, folks who were not able to get to where they needed to go, but we are working to make sure. And so with that information, those resources are still in place. So folks who have transportation difficulties, it's available.
And we continue to work with MCPS to identify those potential sites, especially those school sites along transportation routes that would be available. And we've used the same framework and infrastructure along those lines as well, because again, we want to make sure we have the highest level of accessibility to those individuals that may need transportation, not only for their parents, but school-age kids to get to our sites.
Great. And along those lines, and first of all, Dr. Bridgers, welcome as acting. I believe this is your first session with us in that capacity. And I sleep a little better at night knowing that you're at the helm and have helped us through this transition. And I feel a great degree of confidence in the continuity of service here. So I appreciate you being on board. I know that you all have done really great work in partnership with independent schools as well over the last year. Both to educate and forge partnerships and alliances. And our independent schools are wide in terms of who they serve and where they are. And it's not just folks from affluent communities who attend them. So can you talk a little bit about that partnership and alliance with our independent schools, particularly as we prepare for kids between the ages of 5 and 11 there as well?
Sure. Thank you. Great question, Council Vice President Albornoz. Dr. Stoddard and I actually have a conversation, yet another town hall that I'm picking up from where he and Dr. Gales left off this Friday to talk about vaccinations for 5 to 11-year-olds, to talk about the recommendations. We've also had conversations with Ms. Kinch regarding recommendations by school health nurses and quarantines and outbreaks along those guidelines and those CDC guidelines that we use as part of our framework and our investigation process. And so we will have conversations. We've had conversations over the past couple of weeks, and we have yet another town hall to answer all those questions and provide those supports, as well as look at those sites that we can potentially host again to have those vaccine pods in place so that we can be inclusive in our vaccine administration.
And we do through licensure and regulatory, and also school health, as Dr. Bridgers alluded to, do have regular connections with the independent schools, give them advice and feedback on what they're seeing inside the schools. Obviously to provide that support. But then we're having this much larger conversation, renewing those again on Friday, as we have throughout the pandemic, to really engage on strategy and understand better what they're seeing, and also give them some sense of what we're thinking in terms of the 5 to 11-year-old vaccinations. And we'll talk more about the testing protocols that we're going to be discussing with MCPS and what that means for the independent schools as well. And so all those things will be discussed with them on Friday at a strategic level. And then obviously at the operational level, it's been continuing seamlessly since the beginning.
Thank you. And then a final question. I'm not sure if it's appropriate to ask this now or later, but I'll ask it now and it can be answered later. we had a robust discussion as we implemented the new rapid testing policy within MCPS and wanting to ensure that our school health nurses had the support that they need to be able to comply with the heavy and significant responsibilities that they already had, in addition to ensuring they had the support they need to provide the testing within schools. Where are we with that? What are the updates? I know we had looked into working with contractors to help supplement the work, but I know those contractors are spread thin because we're not the only jurisdiction in the region looking to do something like this. Just any updates you can provide there would be helpful.
That was one of the things I wanted to do as we talked about the full MCPS piece. I will make sure we address that.
Got it.
We have some slides coming up, I think, from MCPS.
Perfect. Thank you.
Councilmember Reamer.
Thank you. I think you're addressing the question I wanted to ask about schools. So you're meeting to follow up on that. Could you just please again summarize for us, what the next several weeks will look like for making vaccinations available at schools as opposed to sending families to county vaccination sites?
Sure, I'll start off, and thank you, Councilmember Reamer, for that series of questions. So, looking back to July, we began having conversations not only about third shots, boosters, but as well as vaccinating those 5-year-olds who remain unvaccinated until we get an approved vaccine online. So we've had multiple conversations with our community partners. We worked with our minority health initiatives. We worked with our health initiative fund partners, and we're having ongoing conversations about those access points to increase equity. And so we continue to have those conversations and plan. We also have had conversations with the Maryland Department of Health and looking at additional strategies, those most efficient strategies that will not only allow us to deploy a robust response to identify those individuals who are symptomatic, but also those individuals who may be eligible for quarantine or an alternate program to quarantine. So what does it look like over the next couple of months? We continue to plan, we continue to have conversations in anticipation of having a vaccine available. We continue to identify sites that won't disrupt individuals' normalcy as we return to some level of normalcy, but identify those sites that have more access, as Council Vice President Albornoz indicated, as far as transportation. We continue to have conversations and open and frank conversations with our MCPS and our independent school partners. So over the next 3 to 4 months, those are the current plans on the horizon as we continue to look at best practices and evaluate those plans to make sure that they're most effective.
Thank you. I'm not sure if I fully am understanding. Are we going to be able to, for example, offer clinics at the high schools, the moment those, that the vaccine is approved?
Yes, we're looking at high schools, middle schools, and elementary schools based on equity to have those conversations and those sites in our independent school systems.
I think the only thing to keep in mind is obviously there are 134 elementary schools, there are 40 middle schools. And so, and recognizing that the school health staff that we were leveraging heavily to do vaccinations throughout the early, the spring and summer months are otherwise occupied doing school health related work. And so it's a matter of how many staff we can get on board. And let me be clear, we've been recruiting for school health nurses continuously throughout the pandemic. And this increased contractor work, we've not, we've set an initial target, but not an upper limit on how far we're willing to go with that as well. So it's a matter of how quickly and how many people we can get on board to do this, with the obvious recognition that, particularly with the Pfizer vaccine, you can't take a bag of vaccine and one person to send them out to a school and expect that to be a successful operation. The reconstitution and other work that you have to do with the vaccine to prep it and distribute it is not insignificant. And so when you're talking about 134 schools, we're thinking more about a cluster-based model where it's, in close proximity to one another, as opposed to 175 elementary and middle schools getting a clinic each at the same time. If we did a clinic at each school, you'd have to order them out where you're doing one school 1 week and then next school weeks later. And so obviously from an equity standpoint, it gets hard to pick and choose who goes first and who goes last there. It is certainly our objective to have as many vaccination opportunities as possible, recognizing what Mr. O'Donnell said, there's 105,000 students that would fall into this category, not just students, but children who would fall into this category. And those represent our best key to drive down community transmission even further by getting them vaccinated. So we're totally on board with having as many opportunities in those initial weeks as possible, but it will be in part dictated by how many staff we can recruit to it's not a monetary issue. It's a recruitment of people who are eligible to give the vaccine issue. And that's what we're working on.
I will just add to that, Councilmember, that we have, as we work to expand rapid testing and talk with our partners that we want to bring on board to do that work, we're also asking them to recruit with the capacity in that same group of folks to be able to switch over to vaccination as for young children as those vaccines become authorized and available. So we are building the capacity, even though we're not yet there and ready to use it. So getting them embedded in the system now will help us to be able to make that pivot when it's time.
And one more key point. So we've got a lot of questions about volunteer. We have parent medical staff who are interested in participating. If you're interested in being a volunteer to support our vaccination efforts in the 5 to 11 population, please do register with the Maryland Response Program. They do the pre-credentialing and get people, badged and identified. I'm quite confident we will be leveraging volunteers to enact some of these processes, these clinics. And so the more people we have who are willing and able to support those clinics is important. So I don't want to leave people who think that, can I volunteer to help? Yes, you can. We just want to have you go through the Maryland Response Program because they'll do the credentialing. And frankly, they provide the liability protections that you would want as a medical provider and things like that.
Okay, so we need parents to volunteer. We asked them to sign up with the Maryland Medical Corps. Thank you for that. And the good news is for 12 and up, we're at 97% plus vaccination rate for our students, which is just it's amazing. Really happy to see that. So we know we should get to a similar place with our 5 and up, and hopefully there'll be a huge burst in the first couple of weeks, and that will really tamp down transmission. And we can just roll this out as aggressively as possible. So thank you.
Thank you. And folks might want to hold off on the schools questions until we see their slides and presentation. Councilmember Glass.
Thank you very much, Mr. President. And following the thought that Councilmember Reamer just said, I too am incredibly proud of our residents who continue to get vaccinated. And according to the slides, 100% of seniors have received at least one dose, and 98% of residents older the age of 12 have received at least one dose. And that's incredible. So thank you to all of our residents. And of course, thank you to Montgomery County, HHS, all of our providers for enabling those actions to have taken place and for people to get healthy and safe. And, we are in the middle, or we just started autumn. And I know a lot of people have gotten sniffles and coughs. And personally, over the weekend, I had some pretty bad allergies, and I was worried that people would think it was COVID. But I know it was allergies, and making sure those who were around me knew that it was allergies and nothing more. And I share that as a way because I appreciate at the top of this presentation saying that it's also the start of flu season. So we have the confluence of allergies, ragweed, seasonal allergies, and the flu. And I know personally that while I'm not eligible for the booster, I'm going to continue waiting and delay getting the booster so that others who are more vulnerable get it first. But I am going to get a flu shot. And so in addition to the pharmacies and the grocery stores, can you share with us what other county facilities residents or at least county employees can go to receive the flu shot so that we can continue being a healthy community?
Sure. Thank you for that, Councilmember Glass. Let me just run down the list. According to the dates that the listing that I received from OMS and our immunization team here. So beginning for employees, I will start with the employee listing. On October 14th, here at Dennis Avenue, we will have the Kaiser mobile van available from 9 o'clock to 12 p.m. On October 20th, the Kaiser van will return, and we will have flu vaccines available, flu shots available from 9 o'clock a.m. to 12 o'clock p.m. On October 27th, at 1401 Rockville Pike in the third floor conference room. And all of this information I will post as well at 9 a.m. to 12 o'clock p.m. on October 28th. We will have flu vaccines for employees. Again, these are for employees at our 401 Hungerford Drive office building and conference room A and B from 9 o'clock to 12 p.m. Now, shifting to our community flu sites, flu clinics at the University of Shady Grove on Friday, October the 15th, from 10 o'clock a.m. till 11:30 a.m. The clinic will be open to students and faculty. And then in the afternoon from 2 to 6 p.m. is open to the public.
Well, thank you. Keep
No,
going.
I'm not finished. I have a couple more.
Okay.
And on Friday, October 22nd, again at the University of Shady Grove, we have the public flu clinic, community flu clinic from 2 p.m. to 6 p.m. And then we have community level sites in collaboration with MCPS and our school health services. Now, those sites are still to be determined. We're looking at, again, equity and access and to make sure that they are accessible along transportation routes. But we are identifying 3 high schools, and that will be determined, and those sites will be posted on our website.
Great. Thank you. Thank you very much for that rundown of locations where residents and county employees can get vaccine, can get I'm interchanging them, can get the flu shot. And I hope everybody takes advantage of that, because we know that the stigma attached in public right now with anybody who exhibits any sneezing or coughing or symptoms like that, people automatically think that it's COVID or something. And, I want to get a mask, quite frankly, that says it's just allergies, but not to confuse anybody, but it's real. And I'll be getting that flu shot. And I do also have questions about schools, and particularly about the outdoor dining and what progress has been made there during lunch, but I'll hold on to that question for that leader presentation. But Dr. Bridgers, thank you and your team for this very good update. Back to you, Mr. President.
And Councilmember Glass, let me just remind folks that we still operate the community level testing sites at our Up-County Regional clinic, our Montgomery County Rockville site, and our Dennis Avenue site. So if you don't know if you have allergies or you're not symptomatic or you aren't sure, we encourage folks get tested. We've increased our testing volume, and we're able to get folks tested to know their status. And if unfortunately they test positive, they're able to know and can continue to further mitigate any community level transmission by knowing that they're positive and quarantining or isolating themselves. So thank you.
Thank you.
Thank you. Dr. Bridges, real quickly, can you just clarify, you mentioned the hours of operation for those and for the vaccination clinics earlier. I've gotten this feedback before, but I didn't hear a lot of evening hours. And I've gotten the feedback from the public that we need more evening hours because people are at work during many people during conventional hours. It would be better if it was a staffing issue to forego, one day during the day and have more evening hours. Can you clarify where we have evening hours available for people?
Sure. Thank you, Council President Hucker. The University at Shady Grove, we have the evening clinic from 2 p.m. to 6 p.m. We have on Friday, October 22nd, 2 p.m. to 6 p.m. And we're working with MCPS to identify evening sites for those high schools. And so we've targeted evening and weekend so that folks can get vaccinated. So we don't have the weekend schedule yet or the daily schedule yet for those 3 high school or those 3 MCPS sites that are yet to be determined. But we've also had a conversation with our team, and we understand the need for greater access. And so we're looking at, in addition to those clinics, having clinics, say, for example, at New Hampshire Estates, we've had conversations with Delegate Trikudian and looking at others if there's flu vaccines available based on our request from the Maryland Department of Health. And so we recognize that we want to have greater access. And so we are planning for more sites, more evening sites. So stay tuned. The sites will be published on the website.
Okay. So you agree that's weakness.
Yes,
So we're gonna
absolutely.
expect to see more soon. Okay, evening.
Absolutely.
Great.
It's been our practice, not only with testing, but vaccinations for COVID, as well as now looking at those individuals who would request greater access in the evenings for flu clinics as well. So we have taken that into consideration.
And last for me, everything's been, but can you just clarify again or confirm the county run tests will catch the variant breakthrough cases for already vaccinated residents, correct?
That's correct.
Great.
That's correct. Based on the
everybody
sequence,
to hear that.
They don't sequence every specimen that's turned in, but the more that we test, the larger the sequence pool that the state labs, Hopkins, University of Maryland, are able to determine and identify the variant, the level of transmission of that variant or any strain in the community. And that's how we can determine that.
Great. And for the vaccination, I hope we'll be making the evening and weekend clinics available, the hours available where we have the lowest vaccination rates, like Silver Spring, Germantown, Gaithersburg, Up County Regional Center, for example, right?
Yes, that's correct.
Yeah, right. Okay, great. Okay, so Mr. D'Andrea, Ms. Dublinsky, thank you for waiting so patiently. Eager to hear your update.
So, Councilman Parker, I wanted to start with a couple of things and then turn it over to Mr. D'Andrea and Mr. Dublinsky. First, just a quick note that this continues to be a collaboration between both MCPS and HHS to try to figure out how we manage to keep our students safe and in school. We've stood up since we started doing rapid testing. We have now tested up to on an average of 1,000 students a week with rapid tests who are symptomatic in the system. And I think what we're seeing is that the combination of the work that MCPS is doing and the work that we're doing together is driving down the numbers of positives. So we are, for example, I think we're running about 1.6% of positives of the tests that we're doing across this past week. I won't go into the details around that. I'll ask Mr. D'Andrea talk about the good news and don't want to steal any of his thunder. But the work with MCPS has been around trying to make sure that we had good systems in place for contact tracing, or for contact tracing writ large. And I think Mr. Dublinsky or Mr. D'Andrea can explain the details about how that process is unfolding. But we're also looking to explore ways to minimize the close contact exposure of students that have tested positive. The fact that we now are doing rapid testing and are only basing our quarantine decisions off of symptoms and our close contact, symptoms and positive tests, and our close contacts off of positive tests means that we're impacting students at a much lower rate, I think, than we have been. It's outside of the school year. The other thing is that we are, to your point, your question earlier, we are, given the stress that our school health nurses have been under, and I want to pause and say both our nurses and our techs that are in schools have done an incredible job throughout this pandemic. And I really do appreciate both the enormous burden we have placed on them and the way they have stood up to that over this last 20 plus months. But they're tired and it's understandable, and they are stretched thin already. So we have been working with providers to expand capacity, and we've asked them to expand their ability to do rapid testing for us and developing a model that allows us to move our testing capacity around to regionally and to do a rapid response for kids when we've got children that are symptomatic, and when the nursing staff is too busy to be able to fold the testing into their ongoing workload. As I said earlier, we're also asking them to stand up and recruit staff that are capable of pivoting and shifting over to vaccination for younger children when it's necessary to do that. So as that comes online, we will be ready and prepared, and the rest is working out when and how we do that in collaboration with the school system. The last thing, and I'll turn it over to Mr. D'Andrea, is that we are working to make sure that we've talked about doing some integration of data, and we've got our IT systems working and coordinating with each other to try to put together an integrated data system. We're still wrestling with that, so we can present you in one place the collective information about testing and vaccination and positivity and close contact quarantines. recruitment is moving apace. We have to, all of the folks that are coming into the system have to pass the background check that MCPS conducts. So they're in the process of working through getting background checks on all those staff. And as they are background checked and cleared, then they're cleared. We're clear to expand our rapid testing process. So with that, I think I'm going to, well, two things. One is just to say, to add my voice to that of everyone else around flu season, and Councilmember Glass, absolutely. I'll be joining you in getting a flu shot very shortly as well. And I will ask people to continue to encourage folks to test and to get tested for COVID-19. It is still our radar for this system. And then the last one is to remind folks that for vaccinations now and for flu shots, pharmacies and drugstores throughout the county are open in the evenings and are available to provide flu shots to individuals. So there is an option and an opportunity for folks to do that. In addition to whatever we stand up to our public, to our county-run clinics, there's opportunities for folks to go, other opportunities for folks to get vaccinated or get tested and get their flu shots. And then I think so I'll stop there on all of those comments, and I'll just turn it over to Mr. Tiandri and let him talk with you about where we are and share with you what I think is some good news in our process.
Good morning, council members. Thank you very much for the opportunity to share today. I want to just start by extending a very special thank you to Dr. Cole and all the members of DHHS for their partnership with us as we've worked to get all of our students back in school 5 days a week. And we know that there's definitely been a lot of successes as well as a significant number of challenges, and we've been able to work together with them to ultimately create the best results for students. And so we were asked today to just share a very brief update on some key data points, and then we're happy to answer any questions that you may have as well. So to start with, I know that Dr. Cole shared information about the rapid testing program in the health rooms. We also wanted to share a very brief update on the screening testing program. As you're aware, the state provides school systems throughout Maryland 2 options for testing programs in schools, one being the diagnostic testing program, which started in the health rooms last week or 2 weeks ago, and then one being the screening testing program, where school systems can partner with state vendors or seek reimbursement for implementing their own testing. So we at MCPS partnered with one of the state vendors, and that vendor is currently operating in 109 schools throughout the school system. As of last Friday, 5,826 tests had been administered through that screening testing program. And again, just as a reminder from the previous visit when we came to the county council a couple of weeks ago, right now the screening testing is operating for grade pre-K through 6th, and then we'll be expanding to all schools throughout the school system throughout the month of October. Of those 5,826 tests that have been administered as of last Friday, only 11 of those tests came back positive. Obviously, we would like the number to be 0, but we're very thankful that the number is so low. One of the other pieces that we know there have been a lot of questions about is being able to look at the data in terms of positive cases by week. And so what you see on the screen now shows information for the 4 weeks of school that have been completed so far. Since we have had several holidays, you'll notice in parentheses the number of school days that occurred during each of those weeks. And then on the right side of the screen, you will see the number of positive cases for each of those weeks, broken down by students and by staff. So you'll see that the numbers are relatively consistent for the first, third, and the 4th week. There is a slight uptick during the 3rd week, which we speculate is possibly due to the fact that during the 2nd week of school, Monday and Tuesday were holidays, which resulted in a 4-day weekend, and we know that there was a lot of travel that occurred during that time. So as of last Friday, we've had 282 positive student cases and then 68 positive staff cases. The next question that naturally comes after looking at the information on positive cases is how many students are being quarantined as a result of these positive cases. So on the next slide, you'll see information about the individuals who are entering quarantine by week. And so for this particular information, I want to clarify that the data that you see on the screen reflects that particular week, how many students and families were notified that an individual needed to go into quarantine during the course of that week. And so for the first 2 weeks of school, there were a significant number of quarantines based on students who were close contacts of individuals who had tested positive, as well as close contacts of individuals who were symptomatic. And so you will see very high numbers during those first 2 weeks of school. Through our partnership with DHHS and the updated recommendations that DHHS provided at the end of the 2nd week of school, there was an adjustment made in terms of quarantine processes for students who had been in contact with symptomatic individuals. And so you'll see that number went down to 0 for the third and the fourth weeks. And then you'll notice from the third to the fourth week, a very significant drop in terms of the overall number of students who are in quarantine, based on the fact that now rapid testing is fully implemented at all 209 schools. So whereas the first week of school, there were more than 2,000 students who entered quarantine over the course of that week, by the fourth week of school, total number of students last week who entered quarantine was 374. And then you can see the numbers overall of students who have entered quarantine at the bottom of the screen, just over 3,200 for close contacts with positive cases over the course of the past 4 weeks, and then 1,744 for the close contacts with symptomatic individuals during the first 2 weeks of school. We've also worked very closely with DHHS on how we partner with schools, in particular the principals and administrative staff working with school health rooms, to be very intentional about making sure that we are following appropriate processes when determining who close contacts are. And so as a result of that, I'll give one other snapshot, which I know is a common question that we receive. For this past week of school, there were a total of 12 full classes that were entering into quarantine, whereas the previous week, the number was 27. And so again, that's due to our work with DHHS and the partnership between school administration and school health services in terms of having the conversations and about who needs to quarantine, and also being very intentional about looking at our practices, making sure that we are sharing best practices across all of our schools. So we're being very thoughtful about how our students are interacting throughout the day. So we are looking forward to, as was shared earlier, some upcoming initiatives that should have even greater impacts on the number of students entering quarantine. And we look forward to our continued work with DHHS, and also just want to thank all the council members for your support as we have worked to transition students back into school. With that being said, again, this was, we were requested to just give a very brief update on some key data points. And so I will turn it back over to Dr. Kroll if there's any other items he would like to share before we open it up for questions.
I don't think so. In this moment, we can go straight to questions. I think you can see that that one of the things that I'm encouraged by is the degree to which the numbers are coming down for students who are close quarantined. And I don't know if Mr. Blinsky wants to talk a little bit about process for how we do this issue of contact tracing, starting with the work that you all have, the planning, the process that you all put together in partnership with the staff over at HHS.
Sure, thank you. Good morning, Council. So we really have tried to refine our practices and the process in which we identify close contacts. And having those on-site rapid tests has really helped in determining when we have to initiate the contact tracing process and identifying the close contacts. When there is a confirmed positive case, I work closely with the principals and give them basically a checklist of things to ask for from the teachers and other staff who have observed the students throughout the day and the 2 days prior to the positive test. So getting feeding charts from teachers, asking staff who are observing at lunch and recess who the students are playing with or sitting with, talking to teachers when they go to specials and finding out what activities they were engaged in. That has really allowed us to drill deeper and identifying those specific close contacts who have that 15 or more minute of exposure based on distance of either 3 feet or 6 feet, and not over quarantining classes. There are times when there are more students in a single class, as students may switch for subject areas or may interact during recess, but we really are taking the time to get specific information on close contacts. Additionally, we have started the onboarding and hiring process of 10 additional contact tracers. We've advertised for 10 additional more hires, so we'll have a total of 20 contact tracers who will be out to be able to support in schools, observe classrooms, and really further determine close contacts.
So, Mr. Blinsky, I just wanted to just to clarify one other thing. Once you all have identified close contacts, that list then how is that list then shared with disease control for contact tracing?
So the principal shares it with the school health professional that's on site. We collaborate with them to determine the extent of the quarantine, and then all that information is sent over to Department of Health and Human Services to be able to enter into the COVID link so they can follow up appropriately with the positive case and also the quarantine cases.
So the public health role in that then becomes to contact the folks that have been the index person who tested positive, and all of the contact families that have been exposed just to get a sense of where they've been in contact with, what their symptomatology is, and to advise them on the length of time that they need to quarantine and on next steps for keeping tabs on what's happening with their child. So,
Sure. And just to add, Dr. Kroll and Mr. Blinsky, when the information is received by HHS Public Health Services in collaboration with the state continues to provide that support for contact tracing, identifying, making the first contact to not only the index case, but those additional contacts that have been determined based on their investigation. More recently, the Maryland Department of Health increased their number of contact tracing of 100 and more, ramping back up in anticipation of not only the current wave that we're in now, but to provide more support to those local jurisdictions who they've previously supported.
The last thing I will say, and I'll stop. We can do I can go to questions if you please. Is that we have the change we see, I think, over the last couple of weeks is a result of the work that we've been doing collaboratively with MCPS, the expansion of rapid testing as well. But also, I believe that parents are now beginning to pay attention and not send symptomatic children to school. And so it is important for parents to remember that if your child is symptomatic, not just COVID symptomatic, but they've got an illness, it's important to keep them home from school. So because that precipitates some of this process of potential positives or potential testing and potential contact tracing and quarantining. So, Councilmember, unless there's something else from our team, then back to you all for questions, Council President.
Terrific. Thank you so much. Councilmember Rice.
Thank you very much. So first and foremost, I just really want to applaud the school system for continuing to navigate these waters and continue to try and answer the call, both from a perspective of keeping our folks in our school community safe and also make sure that we can maintain operating our school system and keeping our kids in the classroom. That's incredibly important. It's a priority that we know you guys share with us. And I really want to thank Department of Health and Human Services for continuing to help as a resource for our school system to be able to make these things happen. Look, at the end of the day, this is going to be about making sure that folks sign on and opt in for testing, that folks embrace the protections that are being put in place by our school system and adhere to those guidelines. And I just really hope that your new process of say yes to the test, or your new sort of public awareness campaign about saying yes to the test and about folks opting in is going to be successful. Because at the end of the day, we will continue to see cases. We know that the school system is just a microcosm of our greater community. And so as we see cases that are in our community, we're going to see cases in our schools. Those things go hand in hand. But at the end of the day, if we can keep them controlled, if we can make sure that we allow for our students to get tested to make sure that their exposure has not been one that has given them COVID and get them back in the classroom quickly, that also is a huge benefit to everyone associated. And so my question is for you, Mr. DeAndrea. Have you seen, when it comes to the community, sort of a shift in terms of folks really understanding that the school system has the best interests of the community at heart, that it really does want to try and keep our kids in school, and so therefore are being more open to opt-in testing, as well as to adhering to some of the guidelines that some of the contact tracers in your administration have to give to parents who've been exposed to COVID cases?
Thank you, Councilmember Rice, and we definitely appreciate all of your support as the chair of the Education and Culture Committee. So to that end, I would say that there definitely has been, we feel, progress in terms of families understanding, the work that's happening behind the scenes with the HHS collaboratively to make sure that first and foremost, safety is our top priority. And our Yes to the Test campaign, Say Yes to the Test campaign is underway now. We have seen results already, and obviously it's in the early stages. But as of Friday, we were up to 36,000, just over 36,000 consent forms that had been submitted for the initial targeted grades of pre-K through 6, which is about 45% of that group, which is about a 15 percentage point increase from just where we were about a week and a half ago. So we are continuing to emphasize that, and obviously we'll be expanding to all grade levels. So that's one celebration, and obviously there's more work to do there. But then in terms of the work with the community in partnership with DHHS, I definitely believe that there has been progress there in terms of, we know that as we transition back to school with 100% of students in school buildings, we knew that there would be some challenges, and we hope that families continue to recognize that we're doing everything we can in collaboration with DHHS to make sure that students are in the building, but also first and foremost that students are safe.
Thank you. That's all I have for right now, President Hucker. Thank you.
Thank you, Councilmember Friesen.
Thanks very much. First of all, the numbers really tell a positive story. So I just wanted to echo the appreciation for significant progress that's been made. I mentioned at the last meeting that I thought that we're taking a major step in a better direction, and the numbers bear that out. I think there's still room for refinement, and it's continues to be a building the plane as we go situation, but the ability to adapt and the improvements that have been made are really positive. Just had a couple follow-up questions here, a few follow-up questions. The description of the, and I don't want to call it contact tracing, to Dr. Kroll, who has proven once again that I am not an expert in public health, so I apologize for that. But in the close contact review, I'll call it, just to make sure that I'm using the proper terms of art and not misappropriating the terminology. The close contact review, to determine quarantining and others before it gets to the health department, is that the principal's responsibility? Is that the local school health professional? I heard both mentioned, but it wasn't clear, who is making that judgment call at the school level.
So I think, Heather, is this one of yours?
The answer. Thank you. So it's not so much a judgment call as it is gathering information. So I lead the principals in telling them what they need to look for and speak to teachers with to find out which students were in close contact. And once they have that information, then we have a collaborative process between me and the principal and the school health. And if needed, we can bring in the additional contacts that I have at Dennis Avenue, the contact tracing department there, to make the final decision of who needs to quarantine. But mostly it's me working with the principal to work with the teachers and the school staff to identify what students had that actual close contact with the individual who's positive.
And are we training the principals on the front end, or is this being dealt with on a case-by-case basis? Something happens, they call you, they talk to the health professional, and it's more iterative, or is there a training and a protocol for all the principals to know what the process is? Because this is certainly outside of their normal duties as a school principal that they have, many have spent their entire careers working towards.
No, definitely. And we hope to alleviate that again with some of the newly trained contact tracers that we'll be having starting as early as this week. I have worked with principals closely since March 2020 on keeping them updated and reviewing processes and giving them, trainings and guiding them through the process. I have great relationships with our principals. They know to call me for any questions they have. So they have been given general guidance, and then for specific cases, because as we know, each situation can be different, they reach out to me and we walk through the process together to identify close contacts and respond to any other issues or questions they have.
Appreciate the 20 contact tracers that were mentioned, because this is something that we have talked about a lot recently and should be talking about always. And, under Councilmember Navarro and Council Vice President Albernaz's leadership, how many of the 20 contact tracers are bilingual? Do we have a determination of that?
I know I have onboarded currently, there are 6 that have gone through the fingerprinting and compliance training module. And one of those 6 is bilingual. And then we will be identifying the other 10 that we just advertised for, putting out that there's a preference for bilingual applicants.
Appreciate that. I would just, highlight the fact that this has been a major emphasis for all of us here. And so I hope that those numbers and that emphasis can be really pushed forward. I know I'm channeling Councilmember Navarro, Council Vice President Albernaz in that, and all of us, but I just wanted to note that. Okay. At our last session together, Dr. McKnight shared that MCPS is communicating with MSDE and MDH about guidance around a vaccine mandate for COVID. Obviously, we have lots of vaccine mandates in our schools. There are state mandates about that. I just wanted to know if there was any progress or any information that we've heard from either MSDE or MDH on movement on a vaccine mandate for students, not just staff.
Morning, Councilmember Friedson. Based on the information we had received from the Maryland Attorney General, it was shared that the Attorney General's opinion was that schools did have the ability to require vaccines for students or for staff. And so we are, as you are aware, the Board of Education passed a resolution, so we are making that requirement for staff members. For students, that is something that we are continuing to evaluate, and the superintendents from all 24 school districts I know have had conversations about next steps in that pathway, since typically vaccine mandates are part of state decisions. So at this point, it's something that's continuing to be evaluated.
So it's being reviewed now, and the school system does have the ability to put it in place for a vaccine requirement for students.
Based on the information that we have received, yes. And so we have, for example, with student athletes who are participating in winter or spring sports, we have already announced that requirement that they have to be vaccinated in order to register to participate, unless they have a medical exemption. Then our next phase is with students participating in extracurricular activities, and we're determining the exact rollout of that, but we'll continue to evaluate moving forward.
I'm glad to hear that it's being evaluated for all students. Just last question. Heard from a lot of parents, obviously it's improved that the number of students who are being quarantined and having to do virtual learning for a period of time has gone down, which is a very positive. There still are, going to be students that have to do virtual because, the nature of this pandemic is not going to be at zero, even though we're working hard to get the numbers down. A number of other schools and school systems have installed cameras into the classrooms. And so when those students have to go from home, it's more of a classroom experience, even though it's not a teacher looking into a Chromebook, in a more traditional Zoom. It's, more of a full classroom experience where you can, see the whiteboard, I guess it's called now. I was going to call it a blackboard, but the whiteboard, as it's called now, and more of a closer to a traditional classroom experience. Is that something that MCPS has looked into? Is that something that could be considered?
MCPS has a fall design team that has been working since last spring on a variety of aspects of the return to in-person learning this fall. And one of those is looking at how we provide instruction during quarantine. So there have been some conversations about that ultimately, if that were to be something that would move forward, that would require close collaboration with our employee associations. Based on the information that we had started with for the beginning of the school year, based on the work of the fall design team, that was not part of the original plan. We were one of the first school systems in the entire metro area to have a comprehensive plan for providing instruction during quarantine, aside from just posting assignments on a website, as was the case in some other school systems. And so we're continuing to evaluate how that's working and make adjustments moving forward. And obviously that goes hand in hand with wanting to reduce the number of students in quarantine altogether.
Appreciate it. Yeah, if you just keep us, posted, not just about that one particular option of live streaming lessons during quarantine, but just the general plan as it evolves. It sounds like it's an evolving process and will continue to be. And so if you could keep us apprised of that, it would be helpful, since obviously we're hearing from a lot of parents, on these particular issues. So thanks for that. Appreciate the responses, and I'll yield back to you, Mr. President.
Thank you, Councilmember Navarro.
Thank you, Mr. President. And thank you so much to this team. This entire presentation, I think, is really a testament to very hard work. I mean, it's clear that other jurisdictions have been working very hard as well, but not all of them have the type of results that we are seeing. And I think that we do need to, pause and also acknowledge how our residents have stepped up from all corners of the county. And what a incredible story to see the vaccination rates, especially for our Black and Latino communities. Really, truly seeing that in our Black community, the gap is almost closed is really amazing. So I just want to really say thank you. Just two general questions regarding MCPS. So when Mr. DeAndre was talking about the data in terms of the cases as well as quarantine, et cetera, has MCPS been able at all to map to see whether there are particular areas of the county where we're seeing a bit more of these issues? Has there been any type of like geographic mapping at all analysis?
We continually partner with DHHS to monitor where we're seeing increases in cases. And so it's really been on a school by school basis, not so much a geographic area basis, but we are communicating regularly with DHHS, as cases arise to ultimately make decisions if there are additional steps that we need to take in partnership with DHHS. We also will be, as part of the 5-point plan that Dr. McKnight shared at the council briefing 2 weeks ago, we will be releasing, looks like tentatively this Friday, an updated COVID-19 dashboard that will provide more information to community members about cases in individual schools, as well as overall numbers of students in quarantine.
So
you haven't yet? Yes.
We've not yet geomapped the data. We are collecting data by school basis, and tracking that. It is part of our challenge with the IT teams is to get them together and to get a reliable and solid collection method in place. The first 2 weeks of this was hand collected data, and then hand collated data. So there's some softness in that data that makes me uncomfortable with relying on it for any kind of major decisions. But as we go forward, we will have data that would allow us to geomap and get a sense of where there may be hotspots evolving in the system.
And Councilmember Navarro, as Dr. Kroll indicated earlier, we're looking at the interoperability of the system, synergy system, what we're seeing in our Immunet and other data systems and Chris, as we continue to upload our respective data to look at those hotspots, if you will, and those mapping points. So we are doing that now, and we're having those conversations. We began having those conversations this week, and our IT teams have gotten together this week to look at the display of the data.
Thank you. I feel very strongly that this is really important. I'm glad that you guys are proactively doing this. Obviously, when we started to deal with the pandemic in March of 2020, as we all recall, we collectively had this very strong interest in making sure that we could get the zip code data from the state, because we wanted to very quickly figure out how we could target our approach and our services and everything. And it was so important once we were able to literally advocate to get that data of zip codes, because that then led to many of the initiatives that now we have seen have made a big difference. So I feel like now we have this subset in terms of a large community, which is MCPS. And that would be, in my opinion, one of the first things that we should be looking at and quickly trying to figure out, how to collect that. And so once we do that, I think that, and of course we should be doing that right now, but obviously we have developed an extraordinary infrastructure. So, the question that Councilmember Friedson was asking in terms of language capacity is really key, and engaging with our hubs and our initiatives, et cetera, truly is such a gift, because that way we don't have to start from scratch. So, Ms. Dublinsky, I hope that you guys are, of course, doing that. I know that I've had also conversations with Dr. McKnight about, all of these particular resources. That is going to be important. I know, I've heard feedback that for some in our, for example, Latino community, parents, et cetera, it's been a little confusing to figure out this whole piece around testing and if you're going to opt in and all of that. So the more proactive that we can be from the beginning to partner with many of these folks who already have, now I call them the experts on the ground on a very grassroots level, that's just going to be a huge help all around. And no doubt the promotores concept, which has been really useful, health promoters, not only in the Latino community, but also within our African American health program, et cetera. That type of model can be extended. So I really want to reiterate that and offer that, because if we don't quickly stand all of this up, we may not sustain what we're trying to sustain. But it is clear, as I think Councilmember Rice said, no doubt with a school system our size, something so unprecedented, to have been able to stand up, coming back to school, having our kids in the classroom, et cetera. Wow, what an amazing and extraordinary effort. And so, yes, kudos to all of you, this team, but also the staff, the administrators, support service personnel, but most importantly, the parents who have had to deal with this anxiety around sending your children back to school. Not easy, but we can see that the numbers are trending down. And I think, again, if we can stand up and take advantage of that capacity that we have in our community already, I believe that we will be able to ride this well and see the types of gains that we have seen throughout in terms of vaccinations. So anyway, I look forward to next week's briefing. I'm very glad that we are, incorporating MCPS. I think it's so important to do that, and look forward also to information regarding the geomapping as well. Thank you.
Yes, thank you. We're very glad MCPS is here. Mr. DeAndre, you may have said this, but are there plans for saliva tests to be offered for students as an alternative to the nasal swab?
At this time, we do not have any immediate plans for saliva tests. All the tests that we are using for the screening rapid tests are coming from the state supply, but that doesn't preclude being able to do it at some point in the future.
Right. Yeah, I mean, there are certainly folks who think that might be helpful both for symptomatic students and staff to reduce the refusals and also for the test to stay issue.
So, Council President Hucker, just to add, we have deployed the point of care rapid testing, but we also recommend those individuals who may be sent home or who've been identified as a close contact follow up with a PCR test, a saliva-based test, and we have made them available at our sites again, and we continue to work with MCPS to identify sites or potential pods if needed or upon request. So we have those collaborations in place based on the infrastructure that we built before, and if we see a need to increase that capacity, we have the flexibility to shift and have those pods as needed. But we continue to work to not only keep students in school, but again, those symptomatic students tested as a confirmatory measure and or quarantine.
Right. Okay. So they're in the community health centers now, not in the schools, but they could be deployed if necessary.
Correct.
Okay,
we've had pods in collaboration with MCPS as we continue to identify, as Councilmember Navarro indicated, those hotspots, those areas where we need to not only test, but in addition to our current strategy.
Thanks. Could you also clarify what MCPS is doing to reduce the number of close contacts in elementary school, whether there's any effort to keep table groups separate in classrooms or any other social distancing? How that's
sure. I'll ask Ms. Dublinsky to go through that pretty much crosswalk. What we can also do at Public Health is just go through the step-by-step measure, the outline, the guideline that we've crafted with MCPS to go through to illustrate what MCPS does along those contacts with the school administrators and teachers, identifying those lists of line contacts, as well as sharing those lists with our communicable disease and our school health services team. So we have a plan that we can share with council, but if Ms. Dublinsky can actually walk through that process, that would give greater detail.
Happy to. So we are, working closely with schools to encourage them to find ways to create space and distance between students in hopes that will even further reduce our close contact numbers. Schools are still using outside spaces for lunch and recess, which has been really helpful. Of course, when there are weather days, that brings kids inside, and Some of our data last week showed that those indoor recess and lunch periods did increase the number of students in quarantine, but we are working with schools to identify creative indoor spaces to expand lunch so they are able to spread out 6 feet. We work closely with schools to give ideas, whether it's setting up tables and kind of bistro areas throughout large common spaces, maybe the entryway of the school or other large hallways, using more areas than just the classroom and the cafeteria for lunch areas to create that additional distance. We are encouraging schools, especially at the elementary level, to have more engagement at the desks rather than doing close, circle time or on the carpet reading, really encouraging staff to create as much distance as possible, knowing that that's going to reduce the number of students we have in quarantine. As Dr. Bridgers mentioned, we work closely with the school health professionals in creating a process where we are not putting burden on either our principals or our school health staff, and that we're working as teams to gather the information, to make the decisions, and where we're really coming together to support the students in the intent of wanting to keep them in school, but also needing to have anybody that's been a close contact quarantine to reduce any transmission within the school.
Okay, thank you. Councilmember Jawanda.
Thank you. Just let me add myself to the chorus as the father of a couple of MCPS elementary kids who's going through a quarantine. Thank you for everything that you all are doing. Those numbers are remarkable. All of us heard from parents, obviously, and were concerned. And the fact that we could turn it around with the size of the system and implement some really good strategies all at once, just big kudos, as colleagues have said, and not only from my role as a council member, but my role as a dad. So thank you for the work that you all are doing collectively. I wanted to ask Mr. DeAndrea, this might be to you or your colleagues. We talked about the close contacts. Could you state the current policy for testing out that's happening if you are exposed, if you are a close contact, or whomever's appropriate to state that? It could be Ms. Dublinsky or
I'll chime in.
Okay.
Okay, I'm happy to. Yeah. I know I've been the one who's been most vocal about this testing to stay protocol that people often talk about, where you can test, is that in lieu of being quarantined, you can test to stay in. As been discussed, it's been implemented successfully in Massachusetts and Illinois, although the systems in those states are not nearly the size of MCPS. So obviously it poses a challenge to do. As we alluded to in the beginning, we're concerned about the strain placed on school health already by the rapid testing that's being done. And so in order for us to feel comfortable expanding and considering some of these alternate protocols, and we are interested in doing it, just so we're clear, we're building towards that, is that we want to make sure that we can buttress the existing testing infrastructure in place in the schools, and then potentially, I don't say potentially, because I think we're going to do this. It's a matter of how fast we can do it and when and along what timeline is to allow for test to stay to be implemented. There are some details they're working through. We have a meeting with the Maryland Department of Health tomorrow to talk through the process, further get some descriptions from or some feedback from them on how we could set up a protocol. We'll be working with MCPS. We have our normal Tuesday or Thursday meetings this week as well to talk through. And so our hope is that over the coming weeks, we'll be able to do it. I don't want to set a timeline for that because I want to see how fast we can get these staff in and through the background check process and get the elements of testing that we've committed to with MCPS already, the rapid testing and including PCR testing on the back end up and running in place before we know, once we see how those things are going, and then know, okay, if it's 374 on a week, that's much more achievable in terms of implementing a test to stay program. And so I think we're inclined to want to do it, but we want to make sure that we can do it well before we implement it. It will likely roll out as a pilot because we don't want to. We probably won't have the full staffing to go from 0 to 175 schools on day one, but we do think we could focus on schools that have been disproportionately impacted by the learning loss, maybe the ESOL schools that we heard a lot about with the Board of Education, something like that, and then expand it out based on success and increase staffing. So just to give a sense of what we're thinking through.
And also just to add, as part of that protocol that we're developing, we've also had extensive conversations about the human resources and the what we would need to implement that. And we have taken those steps into consideration, Councilmember Jawando, to make sure, again, as all have said, not to overburden our school health services or our resources in support of MCPS, but looking at adding to that. And so we're working on what that would look like now so that we can, again, pilot this program.
Great. Yeah, and obviously all this is connected. We want kids who were impacted to be in school, but we want everyone to be safe. And so these are all challenging things. Our size make things a challenge. So I think these are all appropriate questions, but I know if you're the parent at home or the caregiver at home, you want to know, okay, how soon is this coming? Just like you want to know when's the 5 to 11 vaccine coming, which we've talked about earlier. Okay, that's really helpful. And then the other question I had was, as far as the opt-in to be testing, the form that we had to sign and send back in, I might have missed this part. How are we doing on that, getting those back? And what's, I don't know if you have percentages or numbers, or is that going well?
Yes, I can answer that. So we have been doing the Say Yes to the Test campaign, focused right now initially on grades pre-K through 6th grade, and have had a significant uptick just in the past week to week and a half. So as of Friday, we have just over 36,000 students whose parents have consented to testing, which is 45% of the targeted group of students in grades pre-K through 6. So I anticipate that number continuing to increase moving forward. But as you may recall from the last briefing, we were, I believe, right around or just under 30% at that point. So we're making progress and hope to accelerate that more in the coming days.
Okay, so that was just in a week. You said 45%. You said how many thousand was it? I'm sorry.
It's 36,300.
Just 45% of the K-6 population.
Correct.
Great. All right. Well, great. That's not obviously what we want to keep tracking, and we'll continue to put it in our newsletters and help that. That's an important component, I know, to make this work appropriately. So
I will add, Councilmember, on the diagnostic testing, I think we've only seen about 3 to 5% of the parents opting out for the diagnostic testing. So, for example, when there's a symptomatic child, call the parent, get consent to run the rapid test. There's sort of a direct request for consent there, and it is reasonably rare, 3 to 5% that they choose not to.
Right. Great. All right. Well, thank you for your work, and look forward to continued updates. Thank you, Mr. President.
Thank you. See any other requests? So I think that's the end for today. Thank you all so much for all your hard work. It's
Mr. President.
Councilmember Reamer. Councilmember Rice, sorry.
Sorry. Just very, very quickly. Just wanted to mention something, and thank you to DHHS for continuing to put this information out there. But if folks do lose their vaccination card, there's a way in which you can go online and actually have that status given. And so that's incredibly important for folks. Folks think that because you won't get another hard card. So can you just, Dr. Bridges, just talk very briefly about that? Because the information sometimes isn't always easy to find, but I have it now on my phone so that IR portal is there.
Sure.
And so for any resident, having that information is important.
Sure. Thank you, Councilmember Rice, for bringing that up. And so, again, as part of our vaccine strategy, we request that individuals bring or show their ID as well as their vaccine cards. If you don't have your vaccine card readily available for some unforeseen reason, you can visit our COVID portal that we have. We have detailed instructions how to access your vaccine report. It's not a card. It is an 8.5 by 11 vaccine representation, but it shows not only the series of vaccine that you received and the dates that you have received it. So if you received the Pfizer, you will see that you received the Pfizer on X date, first dose, Pfizer second dose, and then if in fact you're eligible for a third booster, that will be recorded as well in the state system. Now, we recognize that early on when the state began to allow access to the My IR portal, there was some challenges about interoperability or sharing information across jurisdictions. The state of Maryland continues to work through that. So don't get frustrated if you did not get vaccinated in your particular jurisdictions. I would suggest that you go to those other jurisdictions, those portals, because it's the same information, but a different access point to print out your immunization record, My IR. And so we have that information available. We have detailed instructions. By all means, if you're having problems, please contact 240-777-2982, and our clinical staff here at Dennis Avenue will be able to provide additional technical assistance and or support. And lastly, if all else fails and you aren't able to bring your vaccine card with you, but you know you've been fully vaccinated, our staff at our community level sites will take the time to look into the system. But please be patient, because keep in mind that that's another step that they're taking to ensure that you are fully vaccinated, that you receive the correct series, and that there aren't any challenges further on down the line. So thank you for bringing that up, Councilmember Rice. That's pretty much the crosswalk.
Thank you very much. And then just lastly, when it comes to senior vaccinations for flu, many doctors' offices across the county have not had the actual senior flu vaccine. Is that something that's going to be provided by DHHS shortly? Do you already have it? What's the progress on that front?
So we haven't gotten any additional flu vaccines for seniors yet. We're waiting for additional information from the Maryland Department of Health. And once we receive that high dose for seniors, we will have those available at our community level sites. But as we receive them, the community level sites, as well as pharmacies and other urgent care and other places that would typically administer vaccines, should have that high dose available. But as we continue to see it, we will continue to post and publish that information that high dose is available.
Thank you, Mr. President.
Thank you. All right. Well, thank you all for all your great work. We're really happy to hear all the good news and look forward to staying in close touch.
Thank you.
Thanks so much.